So today I felt compelled to record this video. It's been something that's been on my mind for a very long time, and I'm going to probably do a series of videos to kind of break things down. But this one's going to be a little bit of a kind of a interpretation of something that I saw today, and a rant on how things are and how they should be, and just kind of clearing the air on some problems that have long existed, and they really need to be dealt with. And I think that it's kind of coming to light a lot more with social media and people sharing their stories, like the person that I'm going to talk about. So let's get into that. So I ended up coming across a video of an individual. They actually live here in Stockton. I'm sure many of you probably know them, and I'm not going to name names because I don't really have permission. I haven't reached out to them yet to talk about it, but I can opine on it, and I can kind of describe the situation, because it's not just her. There are many people that have gone through or are going through this. And what it is specifically has to do with post-COVID, long-term COVID symptomatologies or syndrome. So there is a syndrome that is being or has been established called long post-COVID syndrome, right? And so basically what happens is people get exposed to COVID. They either catch the SARS coronavirus version 2, or they have a vaccine and they get exposed to the spike protein from the SARS coronavirus, and it elicits an immunological response, as it should, right? And unfortunately, the effects end up being unwanted. I mean, you get the immunoglobulin stimulation, so therefore maybe some long-term immunity. Of course, that's being debated over and over again, right? And now, thankfully, there is more and more data coming out to suggest that natural immunity from being exposed to the virus is better than the immunity given through vaccination. But that's not really what this video is about, so I won't go any more down that rabbit hole. Essentially, what happens with people when they get COVID, or they get exposed to the spike protein in COVID, is they have an immune response, right? This happens with any virus in nature, or pathogenic organism, or unwanted protein that goes into the human body. It gets into past the barriers, the skin barrier, the mucosal barriers, and gets deeper into the system. And then, more and more of the immune system elicits an attack response to deal with it. And the idea is that this response is temporary. You beat the infection, you develop lifelong immunity, and you're way less susceptible to it in the future. Now, I'm going to go down another rabbit hole. This COVID illness is genetically, it's human engineered, right? It comes from a natural virus that they have spliced in genetic material into it, and altered it in a way to make it more pathogenic, to get past our immune system in certain ways, to be more infectious, etc. Again, I'm not going to go down that rabbit hole. You believe what you want to believe. I know what I know, all right? It's an engineered bug, plain and simple. It's a novel virus. Of course, not anymore. It's been around for 2 years now, 3, I guess. But it's still relatively new, right? And it's going to take 10 years of data to see the long-term effects of this thing, and for treatments to be fully developed to deal with it. Now, that does not mean that there aren't effective treatments out there. There are very effective treatments. And as a matter of fact, this individual woman who developed long haul COVID syndrome, she was actually laying out a testimonial about the treatments that she and her husband explored, tried, and ultimately what gave her the most help, which ended up being I believe they're exosomal stem cells that ended up doing the trick. Interestingly, I just recently was introduced to this concept of exosomal stem cells while I was in Palm Springs 2 or 3 weeks ago. And I'm very intrigued by it. It's apparently a very revolutionary treatment. There's a place down in Arcadia that I guess has developed a new technology about it, and they're they're getting out and they're marketing it, and it's very revolutionary. I guess a lot of like pro athletes are starting to get into it, etc. Right? The person that I'm referring to, she and her husband went down to Mexico to get this treatment. Now, she didn't just receive that; she also did natural killer cell infusions. I think she actually got the exosome separately from the stem cells. Um, anyway, ultimately, she needed all of these things to help her body address what was going on inside of her. In her story, she explained how she went to her doctors, right? Her primary physician, specialist, etc., and how it ranged from either they just didn't know, what was going on, to they're not willing to test, to they're also not willing to render treatment on her. And she was very shocked by this, right? And I'm going to tell you, I run into this every day in my practice. People go to their physicians to get their symptoms evaluated, or just to run a testing to make sure that they're healthy. Let's get something out right there, okay? Big elephant in the room. uh, your medical insurance is not there to take care of you, okay? Let's cover this, because it's a big point of contention for me, right? Everybody thinks insurance is supposed to be at their bidding because they pay this premium, and therefore they're supposed to do what you want them to do. Guess what? That is not what they do. Medical insurance is not health insurance. Please quit calling it health insurance. It's not health insurance. It's sickness insurance, okay? If you're in crisis, they'll probably cover some testing and some treatment to try to get you out of that crisis. And the reality is, that's all they're beholden to. And it's because of the way the laws are written and the standard of care. Now get that term into your heads. Standard of care. All right? That is what doctors are beholden to in the medical industry, the healthcare industry. That is the standard they have to follow in order to basically keep you from suing us, okay? It's not about healthcare. It's not about doing the right thing. It is about CYA, cover your assets, okay? Keep the people from suing you, okay? Especially in this state, because this is one of the most sue-happy states. It's one of the most litigious states in the union. And so doctors are more and more afraid of being sued than they've ever been. Which is one of the reasons that they are joining organizations like Kaiser and Sutter Gould and other umbrella organizations in droves. Like, besides the fact that they come out making a ton of money right off the bat so they can pay their student loans, they can get into the lifestyle they've always dreamed of, they get in those organizations because now you are no longer on your own, fighting the public on your own, having to pay things on your own, deal with it on your own. You have a huge conglomerated business that can attack problems that come at you, right? And so now they have even more firepower. Imagine, like, going from being a village to joining an entire country. They've got their whole military backing you, right? Their legal process, etc. But the trade-off for joining these big organizations is you kind of end up selling your soul. And what I mean by that is that you are now beholden to this corporate entity. And corporations think differently than human beings do, all right? They don't think like individuals. Matter of fact, there's a great documentary out there. It's called The Corporation. Look it up. I don't remember what year it was produced. I want to say in the early 2000s. But they go through with a bunch of experts, psychological experts, and they profile a number of corporations. I don't remember which ones, probably like DuPont and Pfizer, who knows, right? And they show how they have the characteristics and traits of a psychopath, because they move into areas, they use up resources, they don't care about the local indigenous peoples, They destroy it, and it's all for profit, right? It's all for the selfish intention of that corporation, right? And that's what most corporations are like. And the sad reality is a lot of the reason they are is because when they go public, now they're beholden to their shareholders, and all shareholders care about is money. Everybody wants their stock when they buy it at $2 a share. They want it to go up to $1,200 a share, right? They don't care about the consequences to the environment around them because you're not really shown those consequences. It's such a convoluted and complex structure. You know, finance is terribly convoluted and complex, and that's one of the reasons people don't think about it. The other reason is they just don't care. You know, people just care about money. They want their houses to go up in value. They want their stocks to go up in value. They want their cars to go up in value. They don't care how it occurs, right? They don't care about the consequences. They don't care about how it hurts the people around them. It's just all they care about is the money. And, you know, that's a big issue, but, you know, again, another rabbit hole, right? So, again, these big corporate entities, they care about profit. They look to hedge their risks, their costs, and to maximize their profit, right? And so one of the ways they do that is by minimizing your care, right? They minimize your options and your treatments. Now, you think because you pay a premium, you know, and I realize insurance costs a crap ton more than it ever did especially because mainly of the Obamacare Act, right? Now the risk pool is all over. Everybody is in this risk pool, right? You know, that's the thing about it, right? When you buy insurance, you are hedging yourself against risk. Now, insurance is on the other side of that bet. You have to understand that. And that bet is this: you're betting something bad is going to probably happen to me, and it's going to cost a lot of money, and it could bankrupt me, destroy me, right? I may not have access to these expensive treatments. So I'm going to pay a certain premium every month to hopefully guarantee that I have access to these things and that I won't die. On the flip side, the insurance company has the other side of the bet, right? They say, we're betting that in your life, you're not going to suffer as many catastrophic things as you think you are. But every month we're going to take a premium, and we're going to take that premium with everybody else's premium, and we're going to put it into the system, into the financial markets, and we're going to make a ton of money. And believe me, they do. They make billions a year, and they do not pay claims out of your premiums. By the way, they pay it out of their profits. Otherwise, how could they stay in business? You know, they can't. They grow. How can they grow? They grow all the time, right? Because they're not paying money out of the premiums you're paying them. They're paying it out of their profits, plain and simple. I don't know why it's such a difficult concept for people to wrap their minds around, but it really seems to be. They're always just kind of, so often they're in denial, like, oh, no, they have to do this. Show me where they have to do it. Nobody can do it. Nobody digs into that paperwork. It's complicated. Those laws are complicated. And most people have the attention span of a gnat. You know, for God's sakes, you're flipping through TikTok videos. You know, the videos are like every 15, 20 seconds. So how can you have the concentration to read through all that jargon? Even I have a very hard time doing it, but thankfully I have people that do help me with it, right? So anyway, I wanted to cover that issue, okay? Please stop thinking it is your insurance's responsibility to cover you. So thankfully, you know, going back to the story of this individual, this woman, young woman, mother of, I think, 2 kids, she and her husband realized that the insurance was not going to cover the tests. Her doctors were not going to order the tests she needed, right? And they went outside, they figured out that you can order blood work on your own. I do it all the time for my patients. We don't do it through insurance. It's a lot more affordable than you think it is, okay? We order, you know, MRIs. I mean, MRIs, yeah, they're more expensive than x-rays. Like a set of x-rays is, let's call it $70 on an average, right? For say like a cervical spine series or a lumbar spine series, right? An MRI, they used to be cheaper, but they're more expensive now. They probably average $450 per area. So if you get a neck MRI, $450. If you get a thoracic MRI, $450. If you get a left shoulder MRI, $450. On and on and on, right? But the reality is you have access to it, right? This couple even ordered medications from abroad. You can do that, all right? You can order meds from outside of this country. Now, you typically have to have a doctor's prescription, but not always. And I don't recommend you just start taking things, because I think what they did, in the story she was telling, they ordered medicines to try to treat this condition, and her symptoms got worse, and she had to stop those medications. Now that is one of the drawbacks of doing things on your own, is that without the guidance of somebody that's familiar with it, you're guessing. You're literally throwing darts at a dartboard, hoping that you're going to nail the bullseye of it, right? But the dartboard's not completely clear. You don't have the clear picture of it, right? So she stopped the meds. Her symptoms improved, but she was still left with terrible fatigue and horrible pain, and still not many answers. Now the cool thing is, she ran blood work, and they saw some things on that blood work. And so here's one of my opinions, okay? Here's kind of a point that I want to make. Had I seen, as a doctor, I tell my patients to bring their blood work into me, and I cannot tell you how often they tell me, oh, my blood work's normal. My doctor says it's normal. And I'm like, okay, but if your blood work's normal, then why do you have these symptoms? And, they don't have an answer. And most of the time, their doctor tells them it's in your head. The person I'm talking about, the lady who has the long COVID, the woman, she was told to go see a psychologist or psychiatrist, because they were insinuating that it's in her head, because the doctor can't find it, right? Which is the biggest joke. Like, as a doctor, you can't think outside the box? I mean, come on. It's pathetic. It's truly pathetic, all right? Believe me, we are taught to be clinicians. Now, but the reality is that we are taught to be clinicians, to think, right? To problem solve. Now, I'm not saying that every doctor is equal. There's a lot of lazy doctors out there. They just want to come in, do their job, clock in, do their job, follow the cookie cutter, format. Now, here's something that was taught to me. Like, again, talking about companies like Kaiser, Sutter, they have what are called algorithms. And these algorithms are very complicated, and, they have, thinking software and learning systems that figure these things out, right? They're very intelligent. And they come up with kind of these protocols. And the doctors have to follow the algorithm. Like, if they don't, they can be fired, right? And so, to play devil's advocate, like, okay, so you want to come in and tell your doctor, you're supposed to, advocate for me, right? But unfortunately, because they work for these companies, and because they have, just as many responsibilities, if not more, on the line, right? Their whole livelihood, potentially their career is at stake if they try and help you and go too far out of the lines, right? They're beating the head. It's like trying to go to McDonald's and say, I want you to make a burger with some avocado and, maybe some cilantro, and let's spice it up with some chorizo. If those workers try to do that, they're going to get beat in the head and said, do what you're told, like follow the protocol. The system works, right? They sell millions or billions of burgers every day, right? People are buying them. You're not going to come in there and tell them how to do it without some consequences, right? That's what happens with these doctors. Like they're beholden to these companies, right? They have student loans to pay. They have, mortgages to pay, probably more than many other people's, right? They're big income earners. They have wives or husbands that have certain needs and stuff. They want to take vacations. The kids want, a brand new iPhone every year. As soon as they hit 16, they want a Maserati, or whatever it is they're asking for. They have these problems like many people do, right? And, after a while, you just think that's the norm and that's just how it is, right? So when you come in, you're like, look, you're supposed to do this for me. I've got this weird situation and I need you to think for me. There's a high chance they're not going to do it, right? I mean, their job can be at stake for doing it, unfortunately. So, you as the consumer are kind of stuck between a rock and a hard place, right? And it happens. It happens to me. I'm a doctor. They don't always listen to me. That's why I do a lot of my own stuff. Thankfully, I can do that, right? But sometimes, I get stuck between a rock and a hard place. One of the beautiful things, though, is I can talk to many of these people off the record. And they'll tell me things off the record that they're not going to do in an actual visit because they don't have to document it, right? There's no proof that the conversation even happened. It's unfortunately, the system is geared against us. It's geared against you, and it's geared against us. They don't want us to be thinking physicians. They want us to be good little robots. They want us to stay in the line and not look at the beautiful people on the outside, right? Don't get distracted by the shiny objects. Just do what you're told, right? This is in everything now. It's infected our entire way of living in this country. But this is what you're facing. This is what this woman was facing, you know, going into her doctors, asking for these tests. They even brought in the blood test. They ran, right? They ran these blood tests, showed it to the doctor. Hey, look at these markers. They're off. The doctor's like, I'm not looking at them. They asked the doctor to treat them. The doctor refused. They went to another clinic that's kind of not mainstream, right? That's on the fringes, that thinks for themselves. They told them what to do. Go back to your doctor, tell them to prescribe them these medications, right? You know, it's coming from a physician, right? Oh, they're going to listen. No, they didn't listen, all right? They refused to do the treatment. They refused to give them the meds. All right, I got a great example of this, right? I had a patient come into me a long, long time ago when I first started doing functional medicine, which is kind of this type of work, right? This fringe work. And she came into me with symptoms of hypothyroidism. But she also had a weird like bowel obstruction. I couldn't figure out what was going on. Like she was having bowel movements maybe once a week. She was really skinny, in really good shape. She looked young for her age. She was a teacher. We ran some tests on her, and I convinced her to run a bigger panel than normal, and then she had to go outside of her insurance, pay out of her own pocket. She did it, thankfully. We discovered that we ran a more advanced thyroid panel, and I run those all the time. People think the thyroid test that your doctor gives you is it's not a full panel. Like they run a TSH, which is a signaling from the brain to the thyroid, and they run maybe a total T4, which is the predominant thyroid hormone in your body, but it's not the most active. The most active is T3. And they don't always test that, right? But I did above and beyond that, and I ran something called thyroid antibodies, which is, we wanted to determine, is their thyroid being attacked by our immune system? Lo and behold, it was. Super common. Over 90% of women's hypothyroid is due to autoimmune destruction of the thyroid, by the way. All right? Think about it. If you ever think you have it, run those panels, right? So we found that. Immune system's going nuts. But here's the thing. Again, think like a clinician. Is the autoimmune condition the problem, or is there something else? Well, the problem is the immune system. What is driving the immune system? The immune system never goes nuts on its own. There's always something that triggers it. There's always something in the environment. Now, a lot of times, there's an underlying genetic predisposition. So there's these genes called HLA genes. And so an example would be HLA-B27. If you have that gene and you sustain enough of an environmental trauma or trigger, the condition that oftentimes is expressed due to that gene is called ankylosing spondylitis. And it's when the immune system fuses the spine and the joints in the pelvis, and the people get really stiff and they have a lot of back pain, right? And so I think there's like HLA-DR3 or 2. I want to say that's the one that kind of predisposes people to celiac disease. And there's all these different HLA genes, right? You get these environmental triggers. You have to look for them, right? You have to figure. So here's the thing. It's usually underlying infections. A lot of times they're subclinical or subacute, usually chronic, all right? Heavy metal burdens, detoxification problems. Body can't detoxify anymore because those systems have been depleted, overworked, overran, right? Food intolerances, food allergies, right? They're super common. And then going back to the infections, right? Oftentimes there's multiple. Like there could be Epstein-Barr, which causes mono. Or any of the herpes family of viruses. Herpes simplex 1, which causes cold sores. Herpes simplex 2, which causes the genital ones. Human papillomavirus, which causes warts. Cytomegalovirus. Like there's all these viruses in many of them in the herpes family, that you cannot get rid of, and all you can do is lock them into dormancy, put them to sleep, and oftentimes they reactivate and then they trouble your immune system, right? And then you'll get subsequent infections on top of it. So probably in the situation like this woman who got the long COVID, like what I would suspect is probably if somebody had searched and done some preliminary work, they probably would have found there's probably some kind of genetic abnormality in her ability to detoxify. There's a couple of genes. They're called the MTHFR gene. Naturopaths and functional medicine docs will call it the mother effer gene. Hopefully that's not offensive, but it's just kind of funny. It's easier to remember, right? Those genes, mutations in them, they make you more susceptible to detoxification issues, right? You do not detoxify as well. Oftentimes, these people have problems with medications, like they don't clear them out quick enough. They have more side effects. They usually have a lot of problems with vaccines too. They have more vaccine reactions, right? Again, it's the elephant in the room. Doctors are not talking about it. It's ridiculous. You know, some are, some are doing it. Like the natural fringe doctors talk about it. Your mainstream doctor, your physician is not talking about it. Not likely, okay? Because the system doesn't want to talk about it. They don't want to discuss this elephant in the room, right? There's a lot of liability at stake, and the drug companies stand to lose billions of dollars. You are not more important than billions of dollars. It's just the reality, right? You know, so, and I'm not saying that to be mean. It's the truth. I'm a truth seeker, right? If the truth is, I got to punch you in the face 100 times to get this across, you know, do it. Thankfully, that doesn't happen. But, you know, I mean, you kind of get what I'm going at, right? The truth hurts, but it sets you free. I would rather take the red pill than the blue pill any day. I want to know, right? It hurts. It's scary. But again, it sets you free, right? You can make decisions. You control your own life. You're the master of your own ship, right? So, yeah, they're not going to tell you about these genetic abnormalities, these underlying things. They're not going to screen for them, right? You have to do it on your own. Things like 23andMe can help you do that, right? But you got to pay for it out of your own pocket. Doing these lab works like through companies like Rupa Health, or through like, there's a couple of co-ops. I think there's like Ulta Labs and stuff like that, right? There's some of the ones we use. I use Principal Lab as well. They farm it out through LabCorp. But we have to order it through our account, because, you know, they use providers. They pull us together to get those prices down, right? But like, you know, I have access to Rupa, which is, you know, provides even more discounted labs, tons of them, right? At the flip of a switch, to the touch of a fingertip, right? So you have, you know, get those labs and look for these things, right? And it's all there. You just have to look for it. You have to find, you know, the resources for it, and you have to spend out of your own pocket to get it. All right, quit asking for your insurance to cover it. It's one of the reasons I don't do a lot of this work anymore. I got tired of people saying, well, if my insurance doesn't cover it, I want it. But on the flip side, they're like, well, I need it. And they drove me nuts. They just drove me insane. And the other problem is they're not willing to do the personal work. They're not willing to give up bread or potato chips or whatever, right? They're not willing to clean their diets up. You know, this goes for people who have supposedly good diets too. Like, I can't tell you how often I've ran into vegans, and they think that because they're skinny and they haven't had problems that they're fine, and they don't realize that those diets also cause imbalances and can set the stage for these types of situations, right? I'm not saying there's any like extreme diet that's good for you, but I am saying you have to be very open-minded. You have to be willing to listen to the advice of the doctors that do this kind of work. And unfortunately, I don't find that most people are either willing to listen or to do the work or to spend the money, right? So that's why I don't do a lot of that in my practice, even though I'm talking about it today, right? But in this situation, say with this woman that, you know, I was talking about, that had the hypothyroid thing, right? Let's go back to that. Sorry, I know I'm jumping all over the place, and I apologize. The woman that was my patient came in with the bowel obstruction, or, you know, the infrequent bowel movements, the hypothyroid, the Hashimoto's disease, which was the autoimmune thing, right? We figured out I think she had Epstein-Barr. I think we had a test that kind of suggested she had parasites, but I couldn't pinpoint it, right? So I had actually helped her with her hormonal issues. She was very low in vitamin D and a bunch of other nutrients. We gave those to her. Her diet was already pretty clean. I think there was a couple of foods I had to have her eliminate. I ended up sending her to a colon hydrotherapist. Her name is Paula Ray. She's here in town. Excellent colon hydrotherapist. Highly recommend her. Sent her there. She did one session and nothing came out of her bowels. Nothing, just gas. And then the second session, I got a phone call. And it was Paula calling me, telling me, you're not going to believe what came out. And I said, what? And she said, a worm, at least a foot long, came out of her intestines. And I went, the light went on. I said, she's got roundworms. She said, roundworm infestation. Roundworms are a parasitic worm. They bore usually through the feet. You pick them up around livestock most of the time, but you can get them in the forest and whatnot, right? She had roundworms. And so I did the right thing, so I thought. I sent her to her physicians at Kaiser. And guess what? They refused to treat it. They weren't going to give her antiparasitics. They ran like one test. She came up negative. I think they ran another one and said it came up like partially positive, but they were kind of refusing to acknowledge it. By then, she had some come out through her stool, right? Her stool started to loosen up. Sorry, it's gross, but it's a reality. Some came out. She showed it to them. They still refused to acknowledge it, right? Much in the same way, this other woman with the long COVID, right? The tests show her immune system is abnormal. They refuse to acknowledge it, right? She came back to me crying, a mess. So I told her, okay, well, let's address it. We're going to do it nutritionally. Can't make guarantees, blah, 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 blah. Talk to your medical doctor. That's all the crap I have to cover, right? Again, the law is the law. She understand. Gave her some natural antiparasitics. You think a product that has like wormwood in it and black walnut hulls and pau d'arco and a couple other things, right? And boy, did she dump them. They just started coming out. She was so freaked out because, oftentimes the toilet bowl was full of these worms at the bottom. And again, gross, I get it, but this is what we deal with as doctors. Come on. Freaked out about it, and after a little while, the worms quit coming out, and I said, okay, stop the antiparasitics, give it 2 weeks, go back on them, right? Why do I do that? Well, parasites have life stages. They start out as cysts or eggs, and then they hatch and they're larvae, and then eventually they become the full adults, right? And they don't go into the intestines usually until they're adults. So then you have to, and the larvae aren't going to go in there while you've got this toxic stuff coming in that can kill them. So they're going to hang out in the lymphatic stream, and they're going to wait until that stuff is gone, and they're going to burrow through, and they're going to, nest and start feeding on you and grow, right? Wait the 2 weeks, take it again, more of them come out, right? Stop coming out. What do I do now? Let's, take another 2 weeks to maybe even a month off, right? Got to let by then the cysts have usually hatched. They've made larvae. They're in the lymphatics or wherever, liver even. They move their way into the intestines, and that's where they grow, their adulthood and grow through life, right? So she does that. I think she spent a good 2, maybe 3 months clearing these things out, right? And she finally got rid of them. Her bowel movements didn't go complete normal, but I want to say that at first she was doing like 3 times a week, and then eventually like at least once a day, right? You should be going daily. And so, they got pretty normal, but her thyroid ended up unfortunately being a bit of a mess, and she had to go on like some hormone replacement. And what she had a very hard time accomplishing here in the way she needed. And she ended up moving over to England. She got married, moved to England, and I think she gets the treatments there, right? And ironically, they tend to be more open-minded in other places on, helping people. They're more about helping the patients. So, go figure. Going back to the original woman of the story, right? This young woman, this young mother. She ended up going to Mexico to get this exosomal stem cell treatment and these natural killer cell injections, okay? And she's back, and I guess she's working with a naturopath here. And so I actually have another patient that has long COVID, right? And she maybe had some similar things, but she ended up finding naturopaths in the Bay Area to work with her, right? She's actually doing something called ozone therapy. And I had heard very little about this. I looked it up, And what it is, it's a machine. It's kind of like a dialysis machine. They draw your blood out, maybe up to like a pint at a time. I don't even think that much. And they ozonate it. And what this does is it sterilizes the blood. It'll destroy pathogenic organisms. It helps to get the blood unsticky because her blood is really sticky. And she says when it comes out, when they draw it out, it's like little coffee grounds, right? Which I've seen that example in, I think I saw it in a documentary called Died Suddenly. You see these coffee grounds come out, right? These little micro clots, right? And she says that's what it looked like. And the first time she did this, they could only do 2 passes, which means they drew out a certain amount of blood, ozonated it, put it back in, and then drew out another round. And then I guess they tried to do another one, and the blood was so thick and sticky, they couldn't get any more out, which really freaked her out, of course, right? So then she had to go home. I think they gave her like IV vitamin C, IV glutathione, and then some other things. Sent her back home, and like a nasal spray with NAD+, which is another molecule. It's a rejuvenating molecule, energy. It helps to power the mitochondria and the cells, which is very important for every function in the body, right? Especially as you get older, these things tend to get depleted. So they gave her that, but she wasn't getting much benefit from it. She subsequently went back to the naturopath, and they did another ozone therapy session on her. And I want to say she got like 5 or 7 passes out of that one. So the blood thinned out some more, right? Incidentally, as a side note, I've had patients come in with, and we've done blood work on them and found markers like, high fibrinogen levels, or let's say like we do a CBC and their hematocrit levels are really high, their blood's thicker, or we just, suspect that they have some kind of like clotting issue. And I've used a supplement called nattokinase very effectively. Now, I'm not saying that I do that instead of medical therapy. I mean, the reality is, again, I'm beholden to it. I have to do the right thing. Going to send it to their medical doctor. If they put them on blood thinners, so be it, right? But if the patients are that don't want to do that stuff, I would like to try something else. We'll give them that and let them know this is not in lieu of medical treatment. They have to sign the forms, blah, 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 blah. Again, it's just the way it is to practice in this country. But I've had a great success with that. I actually had really good success with myself. I had suspected that I had had some blood thickening issues. I started on nattokinase, and I had a very weird sensation in my head. Felt like there was a lot of pressure in a spot. And this happened a few times after I took it, and it was scary because it really felt like I was going to have like an aneurysm or something. And thankfully, though, one day when I took it, all of a sudden I felt the pressure release, and then no more symptoms after that. And so I take nattokinase. I'll do rounds for like a month or two and take it daily, and then not take it, because your body will get resistant to these things, right? The only thing I really take ongoing is vitamin D. I take that religiously because it's an immune system. It's an immune system modulator. Like, your immune system is always better off having it than not. Most people take it incorrectly. They don't test their lab values appropriately. Medical doctors say that when you run the test, the number only has to be as high as 30. I'm going to tell you that's BS. It should be between like 50 to 80. That's the range that I see where people have the least problems. They're less susceptible to respiratory infections. They have more energy. They have less hormonal imbalances at that range, So it's a little bit of a different bell curve, but I just, again, and this is just anecdotal, right? This is me being a clinician, doing things clinically that seem right. I mean, another clinician may say differently. Medical doctor's going to tell you another thing. I can't go against their orders, so do what you want. This is not medical advice, right? Talk to your medical doctor. Yeah, anyway, that's, vitamin D. I do some fish oil. Right now I'm taking iron because even though I have adequate amounts of red blood cells, I actually have low iron levels. And the way I discovered that is I ran a test called ferritin. And ferritin is how your body stores iron in your liver. And so I found that number was like, so the normal range, right? The clinical range is like between 50 and 180, I think. And mine was like 13. So clearly low, right? I addressed it by taking a chelated iron supplement. And the reason I say that is because Most iron supplements are inorganic, and they will cause you to have bowel problems. They make you very constipated. Like the iron that comes with the pill, you know, the birth control pill, that iron sucks. You want to take like something that's chelated to a protein or more of an organic iron to get your iron levels up. Or just eat steak and red meat, that helps too, right? Doesn't always do the trick, because I eat that stuff and my iron was still low. So I went ahead and took the iron supplement. God, what a difference that made. I couldn't believe the amount of fatigue I was having before, the muscle aching, the exercise intolerance. Like I had all of these things, brain fog. I just couldn't get rid of them, right? Start taking a simple iron supplement. All that stuff went away, right? Because I was iron deficient. It's probably anemic, but unfortunately, based on the standard of what anemia is, the definition of it, I'm not anemic, right? I'm iron deficient, and so whatever. I don't care. I don't care about the definitions. What I care about is the number abnormal or normal, and do I feel bad or good, right? And so I listened to my intuition and my training, and I did it, and you know, that problem has been addressed, right? So again, I'm sorry. I know I'm all over the place. That's what you get with an impromptu video, right? This is not the typical 1 minute video that I record for you, you know, on TikTok and Instagram Reels, you know, and Facebook. This is a more in-depth discussion. It's a very honest, heartfelt discussion, right? This is me opening up as a clinician, as a doctor, and just giving you some of my insights. And I realize this is a long video, and you know, you might have to take some time to digest this. You may need to watch this, like, you know, in pieces, right? And I'll probably try to get my editor to maybe break it up in chunks if possible. But at the end of the day, it may not be possible. So if you've lasted this long, obviously you found the information very intriguing and educational, and I'm glad for that. And I am going to be breaking more of this stuff down for you, okay? I'm going to share it and get it out there because it's something that I've been wanting to do for a very long time. It's something that I should have done. And I just, you know, unfortunately, sometimes I get in my own way. And again, people frustrate the heck out of me. Like, you guys, a lot of people just, they get in their own ways. Instead of listening to their intuition, they listen to everybody else, they get distracted. And these so-called experts, right? There's so many experts out there, and they're authorities. And they're telling you that you're wrong, you know, that this is the way you have to do it, right? But yet it's not working. So what does human intuition tell you? If something isn't working, you don't keep doing it. What's the definition of insanity? Doing the same thing over and over again and expecting a different outcome. You have to go look for the answers, and believe me, they're out there. And there's many practitioners out there that do this stuff, and there's many that do it better than I do, like the people that do the ozone therapy and all that, and the people that helped this woman, you know, that gave her the stem cell therapy. They're probably smarter than me. They definitely know more about that than I do. I'm going to be checking it out very in depth because I like to know about these things. Number one, I'm selfish. I want to know it for myself and for the people that I know that are close to me. But two, I'm going to gladly share it with people that I know. My patients come in, they need an answer. I'm going to give it to them. Are they going to listen to me? Many of them don't. They don't listen to me. The saying, a prophet is not welcome in his own village, is absolutely true. It's ridiculous. But you know what? I am going to continue to share. I've had some great patients tell me then to not give up, to not be jaded, and to allow people to get me down and to go on my shell, because that's what I do. I shell up. I just, you know, I give the bird to the world, and I go, you know what? You're not ready for this information. You don't deserve it. You don't respect it. I get angry, right? But it's not the best way to handle it. It's not, you know, it's not very adult of me. So I'm going to share it. And so here's one of my first attempts to start this process. Hopefully much more organization in my future videos, and maybe less angst in those videos. So I hope you got something out of this. And if you liked it, you know, subscribe to my channels, you know, like the video. If you have comments or concerns, questions, you can leave them below. But if there's something that is probably a little bit more private, do me a favor and send it as a direct message, you know, because there's just things I am not going to discuss out in open forum. You know, I can't do it. There's too much risk involved, and and sometimes it's best that other people don't know your business until you're ready for them to hear your business, right? If it's very personal, DM it to me, okay? All right, thank you. And that's all for this one.